Hi, this is Joya Vanderlaan. I'm a family nurse practitioner, functional medicine specialist, and owner here at Nourish House Calls. I wanted to give a little bit of an overview today of leaky gut or impaired intestinal permeability. That second term is probably going to be better recognized in traditional medical settings. Leaky gut has been sort of pinned as a garbage diagnosis or non existent diagnosis. So, if you really want to sound like you know what you're talking about at your regular doctor, the impaired intestinal permeability is probably the better word choice to use. Um, with that, what does intestinal permeability entail? Well, one of the reasons why it matters is we see a lot of allergies, especially potentially seasonal allergies, but definitely food sensitivities, different than allergies, increase when the gut is leaky. And by leaky, I mean these cells of the gut really have to be butted up together. There's one cell layer thick that is the barrier between our intestinal lining and the bloodstream. And so when those cells kind of separate from each other, that allows a path for food particles, bacteria, viruses, different proteins to get into the bloodstream. And I explain this many times a week to my patients. When those things, food particles, viruses, bacteria, whatever it is, get into your bloodstream, they should not be there. Remember, the gut was leaky, and so it let them through into the bloodstream. The immune system does what it's supposed to do. It recognizes those proteins, whatever they are, as foreign and creates a reaction to them. And that's when you get a long list of food sensitivities. Now, when I see that on a patient, the food sensitivities, just numerous 30 or so, it's not truly a reactivity to the food and you have to avoid the food forever. That's a problem. We need to look at the gut. And so that's another reason why food sensitivity testing can be helpful in many circumstances. So, symptoms that you might have if you do have what's this leaky gut: headaches, attention problems, brain fog, fatigue. Those are kind of more general symptoms that you could have. You could even have more digestive type symptoms like gas, bloating, diarrhea, constipation. All of those, you want to think about what is going on in the GI tract, and then also, of course, in the body as a whole. Sometimes too, I'll see acne or skin rashes, eczema be related to gut problems more often than something that's coming from the outside. So a lotion or something that somebody's putting on their skin, more often I'll see those skin problems coming from within. Sometimes even joint pain or mood issues, sleeping problems can be caused by, or at least in part caused by, food sensitivities, which can be because of leaky gut. And then, of course, with leaky gut, there's increased risk of development of autoimmune condition when you have that permeability impairment, because again, things are getting into the bloodstream from the GI tract that should not be allowed to do that. And they wouldn't be allowed to do that if those cells were butted up nicely against each other with the zonulin glue holding them together. But now those cells are separated and things are getting from the GI tract into the bloodstream that should not be there, and the body has an immune response to it. So, what kind of things can cause leaky gut? The causes are varied. Sometimes it starts with a food sensitivity, or sometimes it starts with food poisoning that you didn't even know happened, right? Your body just kind of fought it off, but there was damage done to the gut or to the microbiome. And when the microbiome is damaged, part of the job of the microbiome is to protect the cells of the GI system. And when that doesn't happen anymore, now you can end up with impaired intestinal permeability. There are also certain medications like ibuprofen that at least temporarily decrease the permeability of the gut. And so when you take something like ibuprofen, if you know you're sensitive to gluten, oftentimes you will be more sensitive or more reactive. If you've just taken ibuprofen, you'll be more sensitive to gluten after that. So keep that in mind too. There are measures, tests that we can do to look at leaky gut. Zonulin is the main, best known in the functional medicine world anyway, of those. And we can test that actually in a stool test. And for me, we use the GI effects test from Genova. We actually get that covered by insurance at 100%. And so that's offered to our members as testing as part of their workup. And then, of course, we follow that over time too. So we want to know what we're dealing with. And that test also shows us maybe why you're having leaky gut issues. Is it an overgrowth? Is it, you don't have enough good bacteria or the right balance of good bacteria? And then we do the food sensitivity testing to figure out, is that contributing to causing leaky gut? So we want to dig deep and look at causes. Why is this happening and how do we fix it? And how do we treat leaky gut? This is a big question, and if you Google it, you'll get so many different responses because it's so individualized. This is not something that Google is going to be able to help you with, probably not even ChatGPT. This is something you're going to want some testing to figure out so that you can target treatment and you're not treating leaky gut for a year. We can treat it in 3 months, maybe 6 in really bad cases. So if you're doing the right testing, you're finding the right causes, and when you find the right causes, you can treat those causes and be pretty precise about treatment and get the patient better. So if you're having gut issues, or if you're having brain fog or muscle aches and pains, fatigue, mood problems, joint issues, those types of things, and you're wondering, now that I listened to this, could this be leaky gut? And you want to get tested, give me a call. We are accepting new patients. You can schedule a discovery call if you have questions. Our website has all the information on it about membership and how we care for patients at Nourish. So if you're interested in that, you can go ahead and click the link for a discovery call. We're happy to answer your questions and kind of get you started with the care that you need.